everyone. Today I'm diving into a question many moms to be always ask. And it's a question that I think deserves a good answer. That question is, if I'm living with diabetes, will my child develop it too? Whether you have type 1, type 2, gestational diabetes, this video will give you real and reassuring answers. So, firstly, type 1 diabetes has a genetic component, but the risk is relatively low, probably around 2 to 9%, depending on which parent is living with type 1 diabetes. So, it has more of an autoimmune component, and you add in the genetic mix, and that's boom, type 1. But it has a relatively low probability. And then for type 2, it has a very, very, very strong genetic link, especially if both parents are living with diabetes or have first degree relatives from both sides living with type 2 diabetes. So that's why for me, my kids have a higher genetic risk because my both parents live with type 2 diabetes. My father-in-law, my great-great-grand, 6 generations before myself, all lived with type 2 diabetes and died from complications as a result of poorly managed type 2 diabetes. Gestational diabetes, well, this doesn't really mean that your child will develop diabetes, but it does likely increase the risk in future. You want to know the best news? You, as an individual living with diabetes, you've got the power to stop your children from developing diabetes in future. So what do I mean by this? By keeping your blood sugars in check during pregnancy, you can significantly lower the risk for your baby to develop diabetes in future. More good news though, healthy pregnancy is equal to healthy baby. So here are some go-to tips. You must keep your blood sugar levels stable in your pregnancy. You must eat your balanced diet during your pregnancy. You must stay active. Don't say, oh, I'm pregnant, I can't take a walk, or I can't do any form of subtle exercise. You must be active and you must go for your regular checkups. Remember, having diabetes does not mean your child's health is at a very high risk, especially if you stay informed as a mother carrying the baby and you take all the necessary preventive action by exercising, eating well, and making sure your blood sugar levels are always stable. So if you find this video helpful, like, subscribe, and share with someone who needs this encouragement today. And I'll be looking forward to being here again to share more healthy educational tips on how you can live well with diabetes. Bye.